Hello Year 9 and welcome to today's lesson. We're looking at Inquiry 4, Medicine in Modern Britain 1900 till present day. So far we've looked at how has understanding of disease improved since 1900. We've looked at how did prevention and treatment improve after 1900. And we've looked at our first case study on the development of penicillin. In today's lesson, we're going to look at our second case study on lung cancer. If you've not done so already, now is your opportunity to highlight, underline or tick our dates, preventions and our case study lung cancer key terms for today's lesson. Pause the video now and press play when you're ready to continue. We'll be looking at 4.1 to 4.8 in today's lesson, so please can you have these pages in your workbook open and ready to look at. Our inquiry. Between 1900 and 1970, there has been a considerable increase in the number of people getting lung cancer. Improvements in diagnosis, treatment and prevention have helped to reduce the rate of increase. Your job is to understand how this happened. 4.1 Information. Lung cancer in the UK. Lung cancer is the second most common cancer in the UK. It affects mostly people over 40 and especially between the ages of 70 to 74. Most lung cancer cases are people who smoke or have previously smoked. Other chemicals in the air, like radon gas, are sometimes to blame. There were very few cases before 1900, but by 1918, 10% of cancers were caused by lung tumours. Aggressive advertising by the tobacco companies since the First World War led to a huge rise in smokers. In 1950, the link between smoking and lung cancer was proven by the British Medical Research Council. Nevertheless, lung cancer deaths among men continue to rise until 1973. The death rate among women continued to rise until the 1990s. 4.2 Information. Diagnosing lung cancer. Lung cancer is hard to treat because it is often detected too late. Patients often mistake their symptoms for other diseases, and there is no screening program for the disease. In the early years, doctors used X-rays to look for lung tumours, but this was not ideal. X-rays were not detailed enough to accurately diagnose cancer. However, improvements in science and technology have improved diagnosis, as you can see below. Have a read of the diagram, pause the video and press play when you're ready to continue. .4 Task. We've read Information Box 4.2 and we need to make a summary diagram of the types of technology used to diagnose lung cancer. Pause the video here to complete this on your own. There's no right or wrong way of doing this, and you can press play to see one way of completing the summary diagram. Patients are given a CT scan, and this is a detailed image of inside the body. Patients are injected with a dye beforehand, which helps the lungs show up clearly on the scan. If the CT shows possible cancer in the lungs, doctors will do either of the following. If cancer is not advanced, the patient will be given a PET CT scan. Radioactive material is injected into the body, which helps the doctors to identify cancerous cells. The patient may be given a bronchoscopy. This uses a tool like an endoscopy called a bronchoscope. The bronchoscope is passed down into the patient's lungs and collects a sample of the cells for testing. From these tests, the doctors can tell what type of cancer the patient has and how advanced it is, which allows them to draw up a treatment plan to attack the cancer. 4.5 Information. How do we treat lung cancer? Pause the video here and have a read about transplants, radiotherapy, chemotherapy and genetic research, and press play when you're ready to move on. We're going to skip 4.6 Make It Stick task and move on to 4.7 Information. Preventing lung cancer. The British government was slow to take action on preventing lung cancer. There were two main reasons why. The government was earning £4 billion a year from the tobacco tax, and thousands of British jobs relied on the tobacco industry. There was opposition to the idea of government limiting people's freedoms by stopping them smoking. However, the death rate was so high, the government eventually had to get involved. It took a number of actions, which you can see in this table. Sort the cards in Information Box 4.7, which you can see below, into two categories: forcing people to change their behaviour and influencing people to change their behaviour. As you can see, I've highlighted each of these a different colour. You may wish to do the same or use different coloured pen for each of them. Complete this task on your own. Press pause to do this and press play when you want to see the answers. A. In 2007, the government banned smoking in all workplaces. People were no longer allowed to smoke in pubs, cafes, restaurants or offices. This is forcing people to change their behaviour because it's about the government banning smoking. B. In 2015, the government banned smoking in cars carrying children aged under 18. This is because evidence suggests second-hand smoke has a negative impact on health, especially among children. The government stepped in because in these cases, it is not the choice of the child to be exposed to the smoke. Again, this is forcing people to change their behaviour. C. The government has produced many campaigns to advertise the dangers of smoking over the past decades. These include highlighting the impact of pregnant women smoking, the number of chemicals in cigarette smoke, and statistics about the health impact of smoking. Education to discourage young people from smoking is now included in schools. This is influencing people to change their behaviour. D. In 2012, the government stopped shops from displaying cigarette products to discourage young people from taking up smoking as a habit. Again, this is influencing people to change their behaviour. E. Increased taxation on tobacco products was introduced to encourage people to stop smoking by making cigarettes more expensive. Again, this is influencing people to change their behaviour by making smoking more expensive. F. In 2007, the government raised the legal age for buying tobacco from 16 to 18. This was to try and reduce the number of teenagers who smoked. This is forcing people to change their behaviour because it's the government stepping in and raising the legal age. G. The government introduced a ban on television cigarette advertising in 1965. This has developed further, and the government banned cigarette advertising entirely in 2005. This included stopping tobacco companies sponsoring major sporting events such as the Grand Prix. This is influencing people to change their behaviour. And finally, question 2 of 4.8. Give examples of each of the following: the government encouraging people to quit smoking, the government preventing people becoming smokers, and protecting non-smokers from smoke. Have a go at this on your own. Pause the video and press play when you're ready to see some potential answers. The government encouraging people to quit smoking by increasing taxation on tobacco products and making cigarettes more expensive. The government preventing people becoming smokers. Well, in 2007, the government raised the legal age for buying tobacco from 16 to 18, protecting non-smokers from smoke. In 2007, the government banned smoking in all workplaces, and people were no longer allowed to smoke in pubs, cafes, restaurants or offices. Or, in 2015, the government banned smoking in cars carrying children under the age of 18. Before we finish today's lesson, remember to go back to the start of Inquiry 4 and tick your learning objectives. You should now understand why lung cancer is a problem in the UK and understand how diagnosis has improved, and you should be able to explain how lung cancer is treated and prevented. Well done for today's lesson. Take care and thank you for watching.